Bismillahirrahmanirrahim. The quote of the day is success is a lousy teacher. It seduces smart people into thinking they can't lose. Bill Gates. My name is Dr. Ida Sharam Sarwar, and under my supervisor, Professor Dr. Saira Afzal, today I will be presenting Health Management Information Systems, also known as HMIS. Learning outline for today is definition, objectives, characteristics, fields of HMIS, sources, problems or constraints of HMIS in Pakistan, as well as its challenges, benefits, WHO support, and recent advances. Learning outcome. At the end of the presentation, participants will have a broad overview of what a health management system is, what a health management information system is, and what its presence entails in Pakistan, the characteristics and sources of HMIS, what benefits it brings forth, and challenges faced in Pakistan along with its components. Light will also be shed on electronic HMIS and its recent advances. Health management information systems are one of the 6 building blocks essential for health system strengthening. HMIS is a data collection system specifically designed to support planning, management, and decision making in health facilities and organizations. Its definition is that it is a system in which collection, utilization, analysis, and transmission of information is done for conducting health services, training, as well as research. Objectives: to provide reliable, latest, useful health information to all levels of health officers and administrators, to amend health policies and working systems on the basis of feedback received from health information system, to provide information about periodically and time-bound programs and for midterm evaluation, to contribute towards achievements of objectives of health policies and programs, and to increase efficiency and quality in health management. Characteristics. According to WHO, the information should be problem-oriented, information should be population-based, functional and directorial wording should be used, information should be expressed in short and in imaginative forms such as graphs, charts, and tables. Facility for data feedback must be present in health information systems. Latest technology should be used. Unnecessary figures or data should not be present in the information systems. And for information management, organizational structure needs to be present. Domains and fields of health information system. This includes demography, vital statistics, health system input, output, health determinants, health economics, health status, health infrastructure, resources and outcome, financial statistics, environmental health statistics. This flowchart basically shows the flow of information process. It starts from data collection, which is brought forth from resources. Then there's data transmission, processing, analysis, and information for use in planning and management, which comes from organizational rules. Sources of HMIS. Census, registration of vital events such as birth, death, marriage, etc., notification of disease and disease registers, records and reports of hospital statistics regarding environmental health, statistics regarding health sources and services. Sample survey from the national, for example, the National Sample Survey Organization, population survey, statistics regarding effort to check epidemiological diseases and researches in this field, school record, economic planning and plans of social security. What is an HMIS? Health Management Information System collects, stores, analyzes, and evaluates health-related data from health facility to district, regional, national, administrative levels. It provides analytical reports and visualizations that facilitate decision-making at all of these levels. HMIs are also referred to as routine health information systems. A HMIS derives much of its information from patient-provider interactions in health facilities. Hospitals, health centers, and community outreach services provide healthcare across preventative, promotive, medical, and surgical rehabilitation and palliative care interventions. The HMIS also collects data from beyond government-run facilities, including from non-profit, for-profit, faith-based facilities, and from service delivery sites such as prisons, schools, workplaces, and communities. Facilities collect data which are integral to the services they provide to ensure good management of patients. Health managers aggregate and report the data to higher administrators, for example, district, regional, and national levels. When aggregated, the data provides information for epidemiological surveillance and for monitoring health services performance in terms of access, coverage, quality, and equity at all levels of the health system. The information generated shows the range and volume of services delivered to the population, including prevention such as immunization, antenatal delivery and postnatal care, treatment of acute conditions such as malaria, diarrhea, and upper respiratory tract infections, chronic conditions such as HIV, TB, high blood pressure, and management of surgery and trauma. In addition to generating information on interventions, admissions, treatments, administrative and health outcomes, the HMIS also provides data on the availability of services, infrastructure, equipment, and supplies needed to deliver such interventions. The HMIS provides information for local planning. It also contributes to country level monitoring and evaluation, research, policy, and planning, and generates indicators about outputs, outcomes, and impact. Subsystems and subcomponents of HMIs include epidemiological surveillance, routine service reporting, specific program reporting, administrative systems, vital registration. Why an HMIS? HMIS has different and sometimes conflicting functions: operational, informational, and decision making. The operational and decision making functions are essential to ensure proper management of health services for patients or clients. The broader utility of HMIs is to complement data from other health information system sources to build an evidence base for health sector performance assessment and strategic planning. The main users of HMIS are managers and care providers at district level and below. Executive managers, public policy makers, and researchers can also use HMIS data for governance and research. Problems or constraints of HMIS in Pakistan. Number one is structural. Under this, there is multiplicity of institutions and departments, fragmentation of data, lack of infrastructure facilities for storage and maintenance of records. Procedural, excessive information, encryption, hidden issues, exhaustive information, seldom its use, overburden of collection and recording of data along with general healthcare, incomplete, unreliable, and unintentionally managed information, time-consuming procedure, confusing coding, long list of indices, absence of feedback to information suppliers. Then this problems include related to content, which includes mostly service utilization statistics. Only summarized information reaches at higher level, less emphasis on socioeconomic information, not user-friendly. Fourth, related to human resource, absence or lack of skilled medical record professionals, lack of opportunity for in-service training for the staff. Healthcare providers, nurses, biomedical trained persons are collecting and preparing data, lack of motivation and extra incentives. Technological issues include manual paper-based system, absence or lack of computerized data system. Challenges for HMIs: low levels of public will about vital registration system, inadequate government capacity, and lack of firm political decision. Gender issues in vital events registration, fragmentation of health information, and problems in establishing a unified information system within the country. Now coming to the benefits. Benefits include helping decision makers to detect and control emerging and endemic health problems, helping in monitoring progress towards health goals, and promote equity, empowering individuals and communities with timely and understandable health related information, improving quality of services, strengthening the evidence base for effective health policies, permitting evaluation of scale up efforts, and enabling innovation through research, mobilizing new resources and ensuring accountability in the way they are used, improving governance. The District Health Information System DHIS project for evidence-based decision-making and management. Its background: the government of Pakistan developed HMIS in 1992 with the support of US aid. However, after the devolution in 2001, government of Pakistan felt the need of revamping the centralized information system covering only first health facilities. Based on the request from the government, GIK implemented the study on improvement of management information systems in health sector from 2004 to 2007. Through the study, a new health system called DHIS was developed, and the National Action Plan for the nationwide prevalence of DHIS was approved at the steering committee. For the purpose of timely implementation through the capacity development of NHIS, the government of Pakistan asked the government of Japan for technical cooperation. Its objective was routine operation and budget planning and are practiced in evidence-based manner through newly introduced DHIS at the selected districts. Project highlights included The project mainly consisted of the following activities: installation and maintenance of DHIS software. After revisiting the DHIS software, which was originally developed by GICA in 2009, it will be installed at the computers in selected districts and DHIS trainings. Trainings for the DHOs will be implemented by provincial master trainers who will be trained in trainings for PhDs. Monitoring of implementation of DHIS. After the above trainings, the project will keep monitoring PhDs and DHOs in order to achieve the goals. The DHOs submit the DHIS monthly report to PhDs in a timely manner, and the list of identified items for the evidence-based resource reallocation and budgeting is available at PhD and DHOs. Innovation and transformation. For years, healthcare facilities and community health workers have collected data using paper forms or logbooks. This involves laborious and time-consuming data aggregation, compilation, transcription, errors, inadequate analysis and visualization, difficulty in data sharing, and poor management, storage, and retrieval. To address such challenges, HMIS now uses information and communication technology for data collection, aggregation, reporting, storage, and analysis, visualization, and dissemination. This revolution has yet to reach all countries and all levels of health systems, but information and communication technology can improve routine, facility based, and administrative data collection, management, and use for policy and planning. Although information and communication technology facilitates HMI's functionality, health managers need to select hardware and software appropriate to their country's infrastructure capacity and resource availability. Electronic HMI. Sophisticated and powerful data management applications are available for facilities to use to manage their data. For example, the District Health Information System developed by the University of Oslo permits data capture on multiple fixed and mobile devices because the system allows users to enter data offline. It can be used in locations with poor connectivity. The HIR software is an application in support of human resource data management. The LMIS supports logistics and commodities data management. In addition to data entry, data aggregation, and storage functions, these applications mostly have a decision support module that can produce routine or add HOC reports, as well as tailored data visualization products called data dashboards. WHO support. A WHO scooping mission to Pakistan was conducted in December 2016 at the request of the Ministry of National Health Services Regulations and Coordination. The scooping team identified a number of key strategic areas to establish, strengthen, and move forward towards a unified system. Strengthen coordination among various systems and stakeholders, along with strengthening the capacity of staff in data collection, analysis, information transmission, use, and dissemination. The follow-up his review mission visited in July 2017 and aimed at supporting Pakistan's efforts to monitor its health development agenda as well as enhance its reporting capacity on the 100 core health indicators. Recent advances. Health management information system utilization in Pakistan, pitfalls on the way forward. Abstract. Use of data generated through health management information systems in decision making has been faced various challenges ever since its inception in Pakistan. The descriptive qualitative study attempts to explore the perceptions of health managers to identify the status and issue in use of HMIs. Overall, 26 managers were interviewed face to face. The respondents identified a number of hurdles resulting in non-use, misuse, and disuse of data. These included limited scope of HMIs, dubious data quality, political motives behind demand of data, and an element of corruption in data reporting. A great deal of political and administrative will is required to institutionalize transparency in decision making and health management, and HMIs is an important tool for doing so. Appropriate legislation and regulations are needed to create a conductive policy environment that would help in challenging the existing decision-making culture. The effective use of information requires that besides capacity development of district health managers in understanding and use of data, the higher level decision makers are provided with relevant data timely and in easily understandable form, along with recommended actions pertinent to this data. Health Management Information System, a tool to gauge patient satisfaction and quality of care. Abstract. The Health Management Information System is an instrument which could be used to improve patient satisfaction with health services by tracking certain dimensions of service quality. Quality can be checked by comparing perceptions of services delivered with expected standards. The objective of HMIS would be to record information on health events and check the quality of services at different levels of healthcare. The importance of patient assessment is a part of the concept of giving importance to patients' views and improving the quality of health services. Expected beliefs include enhancing patient satisfaction through improved communication, greater provider sensitivity towards patients, and enhanced community awareness about the quality of services and overall better use of services in the health system. Now coming to the MCQs. Question number 1. A health management information system HMIS collects, stores, analyzes, and evaluates health-related data from health facility to district, region, and national administrative levels. The value of information is directly linked to A, its accuracy and completeness, B, its verifiability, C, its simplicity and security, D, how it helps decision makers achieve organizational goals, or E, its fictitious nature.
A.
Yes, you're correct. The answer is A. Question 2. HMIS has different and sometimes conflicting functions: operational, informational, and decision making. Which of these functions are essential to ensure proper management of health services for patients or clients? A, strategic, B, informational, C, operational and decision making functions, D, only operational, or E, all of the above.
E.
Well, the answer is operational and decision making functions, which is 2C. Question 3. HMIS is a data collection system specifically designed to support planning, management, and decision making in health facilities and organization. Information systems that monitor the elementary activities and transactions of the organizations are A, management level systems, B, operational level systems, C, knowledge level systems, D, strategic systems, or E, job based systems.
A.
Yes, the answer is
B.
it's management level systems. Question 4. Which individuals help users determine what outputs they need from the system and construct the plan needed to develop the necessary programs that produce these outputs? A, data entry operators, B, programmers, C, database administrators, D, system analysis, or E, professors.
B. It's E.
The answer is 4D, system analysis. Question 5. HMIS is a data collection system that's specifically designed to support planning, management, and decision making in health facilities and organizations. In HMIS, what plays economically sound and logically in the development process? A, information, B, data, C, statements, D, data flow, or E, procedure.
B. It's E.
Yes, it's D, data flow. Question 6. The health management information system is an instrument which could be used to improve patient satisfaction with health services by tracking certain dimensions of service quality. Quality can be checked by A, comparing perception of services delivered with the expected standards, B, a computerized system for fact checking, C, with the help of a professional, D, with a generalized fact checking sheet, or E, use of specialized equipment.
B.
A. The
A.
answer is A. Question 7. WHO scooping mission to Pakistan was conducted in December 2016 at the request of which organization? The scooping team identified a number of key strategic areas to establish, strengthen, and move towards a unified system. A. ED Foundation, B. The Ministry of National Health Services, Regulation and Coordination, C. Al Khan Foundation, D. The Citizens Foundation, or E. United Nations Development.
B.
Yes, the answer
B.
is B. The answer is B. Question 8. The main users of HMIS are managers and care providers at district level and below. Executive managers and who else can use HMIS data for governance and research? A. Lawyers, B. Teachers, C. NGOs, E. Politicians, or E. Public policy makers and researchers.
E.
Yes,
E.
the answer is E. Hospitals, health centers, and community outreach sources Outreach services provide health care across preventative, promotive, medical, and surgical rehabilitation and palliative care interventions. HMIS derives much of its information from what in healthcare facilities? A. Telephone interview. B. Annual hospital report. C. Logbooks. D. Patient provider interactions. Or E. Surveys.
B.
The answer is D. Patient provider interactions. Question 10. Which of the following functions of management information system reports are generated based on the enterprise's needs? A. Planning. B. Prediction. C. Data processing. D. Data storage. Or E. Data presentation.
A. Data presentation.
It's A. Planning. This is the key. These are my references. And this is the link to the YouTube channel. Thank you.
Thank you so much, Rita. Can you switch off your recording?
Yes. I've switched it off.
Still the recording sign is coming.